Hello, welcome to Hope Ready, a series designed for new students to help you become better acquainted with Hope College. I'm your host, Dr. Ellen. With me today is Cindy Sabo, who is the director of our health center. Welcome, Cindy.
Thank you. Thank you for having me.
Yeah, we're so glad to hear from you today. And I think we can just start with what should our incoming students know to prepare to come to Hope in terms of the health center?
Okay, so all students already should have received an email of some new required forms that are due, and those are due by July 1. You have a patient portal. All students have a patient portal, and in that patient portal are two forms to complete, a health history form, and then also a TB screening questionnaire. Those are the only two forms that need to be filled out. The other thing that we require is a copy of your childhood immunizations. And that if you're within the state of Michigan, those automatically will come from the state registry. So you don't have to do anything. But for those of you that are coming from outside of Michigan, you've got some work to do. So in that patient portal, there is an immunization tab where you can enter the dates from your immunization record right into that portal. And then you will upload a copy of that immunization record so we can verify it. Whether you're in Michigan or outside of Michigan, if you have any immunizations that are missing, we will send you a message so that you have time to get that done before arrival to Hope College. So those are the only things that we require. Now, new this year, major medical insurance has always been required for sure. Hope College students. But new this year, it is being taken over by business services. So if you have not received information, you will shortly, and that's coming from an organization called Wellfleet. And they deal with all colleges and universities, and this is their job, is to provide you information of major medical insurance should you not have any, or maybe your insurance isn't going to work here. So let's say you're on Medicaid from Nebraska. Chances are that's not going to be very useful here in Holland, Michigan. So you would want to look into purchasing insurance that could be used here. So insurance is not required as long as you have major medical insurance that is usable here. So that's where Wellfleet will come in, is they will gather your information and determine if it is usable here in Michigan. And if it is, you'll be cleared for insurance. But if it's not, then they would flag it as being required to purchase that insurance. We want students to have major medical insurance only because if you have an emergency or something major happens, sadly accidents happen, you don't need to go into debt, to worry about that. So that's why insurance is required. Awesome. And if it's okay, Ellen, can I just talk? I'm going to tag on to that a little bit.
Yes.
So those students that will purchase the Wellfleet insurance through Hope College are not the only ones that can use the health center. So all students have access to our health center. So many times we feel people think that, well, I have to buy that insurance in order to come see the Hope Health Center. And so that is not true. We are available for all students. And all full-time students also have something called the Hope Health Benefit, which is going to be part of your insurance or your tuition plan. It's not an insurance, but it's a benefit that can be used in our health center. With that benefit, we don't have to access your insurance at all when you see us. Awesome. So your office visits would be covered. If we dispense medication, most of that would be covered. There is a copay for that. But let's say we order some labs or x-rays, those would all be covered under that Hope Health benefit. So the advantage to that is that you don't have to worry about your insurance to come see us. So if you have a high deductible or a copay, you don't have to worry about it. We want you to get care when you need it. And we want to be able to find out what's going on when we want to know what's going on. So if we need an x-ray or we need blood work, we don't want there to be a barrier that you can't receive the care you need. So I guess that's key, is that, yes, you still are required to have major medical insurance that would be used outside of the health center, but coming to the health center, you have the Hope Health benefit. You don't need to use your insurance.
This is all great information, Cindy. Can you also talk about the services provided right here on campus?
Yes. Basically, anything you would see your home provider for, you can see us for. So obviously illness. illness happens, sick happens, I always say. So you've got a sore throat, you've got a cough that's going on, you're worried you have flu, you're worried you had COVID, you have a urinary tract infection, any concern that you would call your home doctor for, you can call us for. Also injuries. So as long as you don't have a bone sticking through or something, it's not an emergency, you could come here as well. We actually have an athletic trainer that primarily works with our dance students, but also can see the non-athlete student. So let's say you have, you went running over the weekend and now you have knee pain and you're not sure what to do with it. You can call and schedule an appointment with an athletic trainer to have your injury assessed as well. So injury, illnesses, we have a dietitian who does nutritional counseling. So that is always available. We have students that want to gain weight. We have students that want to lose weight. We have students that have special diets. They want to know how to work with food service here. So there's all different reasons why people work with our registered dietitian. Yep. Our providers include advanced practice providers, so physician assistants and nurse practitioners, RNs, we have MDs, DOs, and we also have an OBGYN that comes in every 3 weeks. And she's available for women's health exams. Maybe somebody's having concerns with ovarian cysts in the past, or say heavy periods. She's available to work those things through as well.
That's awesome. So really all the things that you would normally go to your doctor for, you can take care of most things right here on campus. Where is the health center located? When students get here in the fall, how can they find you? How can they schedule an appointment?
Yep, we are in the Dow on the first floor. The best thing to do is to call us for an appointment. I know that's old fashioned, but the reason why we do that is we actually have an RN that triages all of our phone calls. What we want is to be able to assess what your concern is and make sure you get in with the right provider for that. So we don't want to put you in with, say, an RN who, when you really should be seeing a physician or a physician assistant. So you will be triaged, and also an appointment will be given. And we do appointments also because we're working around class schedules. So if we had just walk in, then after every class, there'd be like 15 kids that would come, and it would be hard to get through those 15, and then people would miss their classes. So that's why we have appointments, and that does work well. I know it can be it's kind of a pain, but that's really the best way that has worked for students.
Yep. Well, that's great. And that helps our students as they emerge into adulthood, right? Like you need to make an appointment when you show up to a doctor's office. So that seems to make a lot of sense. Yep, do you have any other advice or words of wisdom for students who are maybe coming to campus who have an illness that they're already dealing with, or if they are on medication for some reason? Any advice for those folks?
Yes. So first of all, we're not here to replace your doctor. But we are here to help facilitate the care between your home doctor, especially if they're far away, and you being able to stay here on campus. So let's say your doctor would like to have some labs run. We have a lot of students that just come in like every month and get labs so that their home doctor can monitor them in California or wherever the doctor is and keep an eye on what's going on. So we're able to do that. If you have a new diagnosis of a chronic illness or a major concern of a chronic illness, it would be nice if we could sit down and meet with you so that we understand you more and not wait until a crisis happens. Yeah. So during orientation weekend, we are available for appointments for students and parents. So you can schedule an appointment to meet with one of our physician assistants to discuss your healthcare so that we have a better idea what you need. And so that when you come in, we already know you, you know us, and everybody feels comfortable of what kind of care you're going to get here.
That's awesome. Really, our collective goal is for Hope students to come and be successful, right? And part of that is tending to their health and well-being as their students here. And you all provide such a great service to our campus. Thank you for telling us a little bit about the health center here on campus, Cindy. And thanks to all of you who've tuned in today. We hope that we will all be Hope ready.